Hi everyone, welcome to Center of Balance Live. I think it's 39 live, number 39. Okay, so I'm going to talk about bicep tendonitis. We're going to talk about bicep tendonitis and what tests for it. How do you know it is bicep tendonitis, and what sort of treatment, treatment is, I'm going to show you some acupressure point that you better do it yourself at home, okay? But in this video, whatever I show you in the past in all my live video is something that I hope that you can help yourself at home. But this is not an advice that once you watch this video and you don't have to go to see a doctor or things like that, or physiotherapies. You still need to consult with your doctor and see what is the best treatment for you. But if you want us to help you, you can come to our clinic. Okay, so our clinic is on in Dinsdale and Hamilton. So this is our hang on, so I have two cameras on today. One is on Facebook, and one's on YouTube, but unfortunately in YouTube that's gonna show opposite. Okay, so but anyway, our phone number is 078467956. Give us a call, and we offer free online consultation and pre-assessment, and up to 15 minutes is free. Now bicep tendonitis, where is the pain, right? In general, pain is over here in front of your shoulder, okay? And because it's a bicep issues that causing the pain in your shoulder, and generally on the front of your shoulder, then it could be pain in your, if it's from bicep tendonitis, it could be pain in your elbow as well, okay, in elbow. But you can say, oh, well, you have pain in front of your shoulder that is equally, say this is that pain is positive in here, and that is bicep tendonitis. You don't diagnose in that way, okay? Because we talk about our rotator cuff issues, and that cause pain in here. And last time we talked about shoulder impingement, and that will be pain in here too. So how do you find out? How do you, as a practitioner, how do we know what's different, and how do we know we're going to run further tests on it? So in general, we ask patients to do this movement. Okay, so put the hand at about 90 degrees. Okay, so the practitioner, like, we will put fingers in here, and to find the we call long head. Okay, long head tendons in here. Bicep have two tendons in here. So one's long head, one is short head. So we do this long head, and we put finger in here, and we feel the long head go across a little bit, and it'll be painful. For if you suffer from bicep tendonitis, it'll be quite painful over here. Okay, now with painful and me, okay, if I holding in here, something like that, and get the hand up here, and we're gonna turn the hand to the thumb side. Okay, right? We turn the hand to the thumb side and back in here to the thumb side, and we press a little bit of push a little pressure in here, and when it turned to that side and pain got worse, the patient will, oh, so painful, and I turn it back, it will hurt as well. So press some pressure in here. This test called speed test. So speed test, once the patient have this pain over here, we feel the tendon and it's painful, and then we do hand in here and put some pressure on the tendons and rotate the hands like this, supination and pronation. This movement we call supination and pronation. So supination and pronation, and it feel pain, and more on supination. And that, for this test, we as a practitioner, we're quite sure this is a bicep tendonitis. Okay, it's simple. I'm not asking you to do your to to give yourself diagnose, and you should get someone to diagnose your physiotherapy, your doctor, chiropractor, osteopath, acupuncturist. Okay, and this is very easy. Okay, now this is the best test for bicep tendonitis. And we talk about symptoms, we talk about tests, and now we're going to talk about, well, what can you do? What can you do, right? To be honest, a lot of people take painkiller. As I mentioned, a lot of time, painkiller is not good. Why is that not good? Because it harms your kidney and liver. Okay, so according to Chinese medicine, we won't ask patients to take painkiller unless that is very bad, that you can't sleep and you can't move. Okay, then in a very severe case, you're allowed to take some painkiller just for temporary. Okay, do not take it for a long time every day, because when this issue become chronic, you may take painkiller for a long time. That's not good. So another idea is doing physio, some exercise, and if those are not working, and further on, you may be introduced to steroid injection over here. And it works, okay, it works, but not for everyone, no guarantee for that. So if you're doing physio, or you haven't doing any physio, and something that you may consider to see an acupuncturist, okay, again, why see an acupuncturist? Why come to see us? Because what's the difference between us and others? So we keep talking about it. This is a symptoms, right? Pain is a symptoms. Now we have acupuncture method to treat pain over here. Then we also treat the cause of the problem. Now we talk about bicep tendonitis, right? What is bicep? Bicep, this is bicep. Okay, here. That's muscle. And connect to the tendons. And the tendons inflame. That's what we call bicep tendonitis. Okay. And tendon issues, we want to check liver and gallbladder, because liver and gallbladder control tendons. And on the shoulder joint, shoulder is the joint, right? Liver and gallbladder control joint as well. Therefore, we want to check your liver and gallbladder. That is why we, as a Chinese practitioner, acupuncturist, we don't suggest people to take painkiller. Why is that? Because if you take painkiller, there's a chemicals thing, and it's going to your liver, and your liver is going to detox it, and it's going to harm your liver, and you get pain. We live for a while, but you get something that's going in and put pressure on your liver. So we don't suggest, right, unless that's very severe. And that is something else you can do. What can you do? I'm going to talk about it later. Okay, stay with me. Now, apart from liver and gallbladder, okay, if you find that you get depression, angry, stress, impatient, irritability, that a lot, and your eyes is problem, or your palm are red, they all indicate, or shaking hand, spasm, vertigo, joint pains. Apart from here, you have joint pain as well, and those are indicate the problem is in the liver. The liver out of balance. Okay, so if you have, if you really have bicep tendonitis and those symptoms I just mentioned, you need to come to see us, because we want to improve your liver function. Because we believe once your liver function get better, then this will get better even faster. Whatever the result in here, it will last. Okay, this is our experience and according to Chinese medicines. Now, we talk about bicep, right? Bicep come with tendons and as well as muscle. So it could be the muscle problem as well. Bicep tendonitis, it could be muscle issues, because we talk about pain will be in here as well. It may be in the elbow as well. Okay, and in this place, elbow. So because there's another tendons in here from biceps. There's muscle in the middle, 2 tendons on both ends. Okay. Then the muscle contract, the tendons pull. Okay. So if the muscle inflame as well, if there is muscle problem as well as tendonitis, tendons inflame, so we need to treat the muscle, which is spleen and stomach. Because spleen and stomach, according to Chinese medicine, they both control muscle strength. Very important. They both control muscle strength. So we know they both control muscle strength. If you have constipation and okay, we talk about it control muscle strength and strength and digestive system and bowel motion. Okay, let's talk about bowel motion. If your bowel motion are loose, watery, okay, or constipation, either one. It can be opposite. Sometimes it's loose, sometimes bowel motion, constipation, sometimes just loose every day. If you have bowel motion problem, if you have bloating, pain in the stomach, okay, bloating, pain in the stomach, or sleepy after eating, all right, and you feel heavy body, you get water retention. What else? Your tongue. Okay, your tongue have a lot of teeth mark on the side. Okay, those all indicate spleen and stomach weak spleen and stomach. When spleen and stomach functions out of balance, then the muscle, including bicep muscle, it won't have enough strength, which means it won't recover properly. If you get exercise on some treatment on here and you get better as you get some relief from the pain, but the pain keep coming back, or you're seeing some acupuncturist or physiotherapy or chiropractor or osteopath, and you got better, but it keep coming back, and it become weak, and it's not too painful but bearable. It's always there. Then you have suffered from few symptoms I just mentioned about from your stomach and spleen function. Therefore, the rest of the pain, it'll be chronic. You really need to get your stomach and spleen function back to normal. Okay, improve the stomach and spleen function. Okay, this is how I find my experience according to Chinese medicine. Not until you improve your stomach and spleen, that chronic pain will go away. Okay, so when your bowel motion improve, you'll find, oh, this is better, even better, and the pain will eventually gone. Okay, so this is my experience. This is according to Chinese medicine. We talk about constitution. Okay, so constitution is the organs in balance. We want to get the organs balanced. They're not just treating the pain, the conditions in here. Now, I want to show you some acupressure point. A simple acupressure point is if you have pain in here, you go to the opposite side, the same thing in here, and get this a massage. But one thing is, when you massage it, you may feel pain over here. I mean, because you're using this hand is painful, and because you're doing this, it may give you pain in here or here. Okay, get your family to massage here, opposite side. So why do I ask you to do opposite side? Because when you do opposite side, you won't get wrong. You won't make it worse. Okay, you only make it better or no results. If you're not a practitioner, you try to massage here. If you massage it on the wrong way, you get more pain over here. So we use opposite side. This is Chinese medicine. We use opposite side to treat it. If you watch all my video on acupressure 1, 2, 3, and we talk about in here, the meridian is, it will involve lung meridian. This is lung meridian. Many involve lung meridian. So we can use groin to treat it too. So groin is over here. There are 3 meridian in here. So using the opposite side of groin, if pain over here, using opposite side of groin, and you go to the groin and get the most sensitive one. When you get most sensitive one, you press on it and give it some wrapping, give it some massage. All right, and this, while you massage it, you can use your left hand to massage on that side, and you try to move your effect, the pain over here. You try to massage it. So massage it for a while, up to a minute. Okay, then you will feel relief from that. But this is very good for what? For symptoms, for releasing the pain, for pain relief. But really, if you have stomach problem and it becomes chronic pain, come to see us, because call us on 0784679956. Okay, so we up to 15 minutes free. Come talk to us to let us assess you and to see whether you have constitution imbalance, whether the organs are imbalanced. Not just that simple. So this is the difference between acupuncture and physiotherapy, chiropractor, and osteopath, and the doctors. Because when we look at the symptom, bicep tendonitis, we always look at the constitutions. Okay, this is always. As a qualified acupuncturist, a standard acupuncturist, we work on that way. Okay, this is something that if you see an acupuncturist, you should ask them, what is my constitutions? Okay, what organs is out of balance? That causing any organs out of balance that link to my shoulder pain. Okay, so this is today's talk, and as you can see today that I have 2 needles up my head. Okay, so I have some headache today. I put needle in here to treat my headache, and it works very well. I have no headache. You may hear that I have blocked nose. My sound is not very great today. I still have blocked nose, but those 2 will help, and I'm going to just put those 2 needles and sleep until next morning, and hopefully everything will be clear up. Okay, this is the beautiful things that the acupuncturist, you can treat yourself as well by using scalp acupuncture. So this is a scalp acupuncture. It's very safe. Okay, it's very safe. I can go and lay on it and sleep with it, and no problem. Okay, okay, that's it. Tomorrow and Sunday. So Saturday and Sunday, I'm going up to Auckland to attend a workshop. So I won't be able to do any live video for you to introduce some other shoulder pain tomorrow. So I'm going to continue next Tuesday. Now, okay, you stay awesome, and I love you all. See you. Bye.